Hello, dear friends, I'm here with you. Sofya Dorinskaya, President of the International Bureau for Human Rights and Mental Health and Head of the Medical Information Center of Sofya Dorinskaya. On our channel, I want to welcome our new subscribers because in just the last few days, the number of subscribers has grown by a third. There are now more than 35,000 of us. And of course, that's really great. Today, I want to talk to you about a substance called glucosamine. This video in general is based on practical experience, and I think that people who have joint problems, these are elderly people, athletes who take supplements to improve the condition of their cartilage tissue. They usually take supplements with glucosamine and chondroitin. So today I want to tell you about a case that happened with one of our clients, an elderly woman, and I want to warn you about some things. So glucosamine is considered to be a precursor of substances that build joints, if you read about it. If you read the annotations on the boxes of glucosamine supplements, it says that they improve the condition of cartilage tissue. They restore cartilage tissue and generally reduce pain, and everything becomes wonderful. But here's a situation we encountered. A lady was taking it for problems with her cartilage tissue, for issues with her knees. She was taking these pills with glucosamine, and then she started experiencing pain in the epigastric region, bloating, abdominal flatulence, digestive disturbances, and she just kept wasting away somehow. And then one day she simply went into shock, a real shock, though compensated, thank God. So we started digging into what happened, what exactly had occurred. We went through all her belongings, all the medications she had been prescribed and was taking. And we came across this particular drug, glucosamine with chondroitin. We started to find out what glucosamine actually is. Well, glucose of pancreas, pain in the epigastric area, bloating. And these are symptoms of pancreatic problems, but there was nothing else anywhere. Everything was calm, smooth, a blessing from God. Supposedly it only helps restore joints. But our search eventually led us to data from a French researcher, well, actually a Frenchman from Canada, sorry. Yes, he is a dedicated expert from a pharmaceutical institute, the esteemed Professor Frédéric Picard. So in studies using glucosamine on animals, he discovered that glucosamine leads to the death of insulin-producing cells in the pancreas. And what's really interesting is this. The professor stated that in their animal studies, they used a dose 5 to 10 times higher than what is recommended by most manufacturers. I forgot the exact dose they used, 1,500 milligrams per day. When we took the box of the supplement that the client was taking, we found out that the daily dose in this product, I'm not going to show the manufacturer, was 1,420 milligrams per day. How can that be? Here we have a supplement where the dose is 10 times higher, exactly the same dose that was used in the experiment. And the professor demonstrated that. Manufacturers overstate the maximum allowable doses of glucosamine in their products in order to make it seem like their supplements are more effective, and so there is more of the substance in them. So why am I telling you all this? Elderly people, especially as statistics have shown, this is the target audience for the market. Regarding the sale of glucosamine supplements, I want to warn you. Be extremely cautious with supplements intended to improve joint function or cartilage health that contain glucosamine. According to all the studies I have reviewed, the effectiveness of these supplements and glucosamine has not been proven. In other words, it's either there or it's not, or it's simply within the margin of statistical error. In America, the FDA, which is the Food and Drug Administration, did not approve glucosamine as a medicinal product. It has remained a dietary supplement. So I can say that actual real-life clinical situations have already clearly demonstrated and proven that glucosamine can truly and effectively help. Has a very harmful effect on the pancreas. Fortunately, in the situation I'm talking about, thank God, in this case, the person we are discussing Everything turned out fine. Everything is okay. Of course, we stopped it and took away that box. And now, unfortunately, this person will never be able to use it again. To all our elderly people, especially our dear beloved mothers and grandmothers, we ask you to please be extremely careful and always carefully weigh the potential risks. This is vital because there is a very serious risk of the permanent death of the critical insulin-producing cells located within the pancreas. What happens next? That's diabetes. Severe, yes, insulin-dependent. Up to, well, if it's cell necrosis, we can assume that it could go as far as necrosis of the pancreatic tissue, and that means intensive care, surgery. And honestly, how it will end there, well, it could even be fatal if we're talking about pancreatic necrosis. What should you do? What should you do if your knees hurt, your joints hurt, and the substance in question, to be honest, is not exactly safe? I recommend using creams containing chondroitin for local application. That is, when it comes to systemic use, making systemic changes, systemic application has a very strong, comprehensive effect on the body. And it's always better to use something locally. And these are creams. Yes, there is such a form, specifically those containing chondroitin. But as for glucosamine, please be extremely careful with it, especially young people and athletes. This applies to you as well, so please take care of your pancreas and pay attention to the doses of glucosamine in your supplements. And you should know that manufacturers, according to official information, do not overstate these doses just to stand out in the market and claim that their product is more effective. So these are very serious matters, because it was actually quite difficult for us to find this information. You simply won't find it just anywhere. That's why I decided to record this video, and I hope it will help someone and answer the questions about why you might be feeling unwell. Please check the pills you are taking, and if they contain glucosamine, my dear elderly friends, please remove this substance from your regimen. This was Sofya Dorinskaya with you. All the best. Goodbye.